They knew that the change needed to come at the policy level, and yet we had to have our roots in the ground. If you don't have the voice of the people, if you're not really in touch with what's happening to the people on the ground, then you can't set your direction. You need those people to be your real advocates.
The expansions to Medicaid have made it possible for more people to access the care they need. And honestly, we should all have access to health care. Every person deserves the right to health care.
There was about 8 months or so that I did not have any insurance. And through that time, I kind of rationed out my medication and I just didn't go to doctor's visits because I couldn't afford it. And I was afraid to start accruing medical debt because I was afraid that I wasn't going to be able to climb out of that debt.
If I didn't come to the nursing home and I didn't get the care that I needed and the shots that I needed and the medicine and all that I had that been done, therapy, whatever, I don't think I would have been alive. I think I would have died a long time ago.
We have this strong system that we've worked 25 years to get to, and now with one bill that's being passed, we're going to see the demise of so much of what we did, and who is impacted by that is the patient. The patient's not going to be able to access care. And people should be able to have the ability to receive care if they're sick, if they need it.
Cutting Medicaid funding would affect far more than just those inside of long-term care facilities. There is a home and community-based waiver services program. We're having longer waiting lists for existing programs, and we also might see some families be forced to make a decision to place a loved one in nursing homes sooner than expected if they're not receiving that care at home.
Some people are stretched so thin that there's nothing left to ask for. You're asking them to stop putting food on the table so that they can pay for a Medicaid copay. So they're going to stop going to the doctor because they can't afford it. And some of these people cannot afford to stop seeing a doctor because their life is on the line.
Anytime that I see barriers to healthcare falling, that's a good day for me. That's why I love working with Kentucky Voices for Health. They are actively pulling down barriers and making that access available, because it should be.